How can patients and healthcare providers collaborate effectively to enhance understanding of diseases and treatment plans?
There are a number of ways in which healthcare practitioners and patients can work together to really improve health outcomes. And those health outcomes are a consequence of meaningful partnership. So that meaningful partnership, first of all, is seeing each other in the room and accepting the expertise that comes with looking after liver disease, of knowing the medications that are available and trusting your doctor to make the best decisions based around those medicines available. And the other part, of course, is seeing the expertise that is living with the condition day after day. And that's living with the emotional aspects, the psychological aspects, the physical aspects. It's living with the long-term clinical aspects. So, for example, liver biochemistry, but it's also about living with the day-to-day aspects, quality of life, symptom burden. It's about listening to all of this, having a two-way conversation and using the best information you have to really help the patient find their own pathway through their liver disease.
How has the PBC Foundation enhanced the mental health and treatment adherence of patients living with primary biliary cholangitis?
The PBC Foundation works incredibly hard to support patients where patients are. So if you're newly diagnosed, if you are months, years, decades in your journey, you'll have different needs. And the foundation really focuses on meeting the patients where they are. So meeting them where they are in life, where they are in language, and where they are in knowledge to then support them as best we can. So how do we do that, and what impact does that have on patients' quality of life? The first thing is to hear a patient, listen to a patient non-judgmentally, and to find out where they are and where the gaps are that need to be met. And then we start to address those gaps one by one, and again, in a way that is beneficial to the patient. Has that improved patients' quality of life? Absolutely. There was a survey recently, I say recently, in the last few years, where we asked patients what was their experience of being supported by the PBC Foundation. And we asked three major questions. Question number one was, did you feel you were able to make a more informed decision about your care? Question number two, are you better able to manage your symptoms? And then question number three, do you feel less isolated because you've used the foundation services? And all three questions had an answer and a 4-point Likert scale of either positive or very positive. And all three questions had an answer in and around 90%, where the answer was either positive or very positive. And so listening to the patient, providing the emotional and psychological support they need, providing the information they need where they need it, absolutely has improved the emotional and psychological aspects of patients living with PBC. The other thing that's really important is when patients come to the PBC Foundation is that the emotional and psychological support that we provide dovetails really nicely with the clinical support that HCPs provide. Bear in mind that we have an international medical advisory board, so everything that we're sharing with patients has been through the clinician's eyes and sensibilities. And so any patient that has the ability to access both clinical and emotional support is able to benefit from both of those.
How can members of the interdisciplinary healthcare team help promote patient adherence when developing treatment plans?
When you consider the question of patient adherence, and we all remember the old days of patient compliance, you will comply. Actually, most people don't. So why do they adhere to their medicine plan? One, they understand it. It's been explained to them in language that they understand why this is the care pathway for them. So the pathway has to be personalized. It has to be entirely appropriate for that patient on that part of their journey. And 6 months away, it might be a completely different journey. But right now, right here, it has to be the right plan for them. And they have to understand why it's the right plan for them. If they understand this, if they have the opportunity to ask their questions, to allay any fears, to address any gaps in knowledge, then that conversation will go a long, long way to making sure that the clinicians are clear, the allied professionals are clear, the patient is clear, the pathway is clear, and we have the best possible opportunity for a happy, healthy patient.
What factors affect patient adherence to chronic liver disease treatment?
I think we need to think about adherence to general management rather than just the treatment aspect, which pill the patient takes. So we have to have a broader view. And I prefer the word concordance because it implies a patient-centered approach. So finding a way of them looking after their health. Patients feel the difference, in particular, whether the team cares about them. Liver patients are particularly sensitive to being stigmatized, and we need to be aware of this. We need to help decrease the stigma, and we need to change the attitudes of the population. It's important to understand the social determinants of health and their beliefs. Some people can't read, can't afford, or have anxieties to use public transport. People are worried taking time off work. And some people believe in alternative or traditional medicine curing their disease. And we need to accept that that's just part of them, and we need to work around it. So it's important for us to have an understanding of what their needs and their background is, and they need to understand their disease better. And vital is also the trust they have in us. So it's important to have an excellent rapport with patients. And one concept I often use, which I feel my patients understand, is if I can tell them, convince them that their liver is the weakest link in their body, and they focus on their liver health more, which is important.
How can individualized treatment plans promote concordance? What would be required on the part of physicians and patients to accomplish this?
I think the main thing is to build a trusting relationship. And we, as healthcare workers, are responsible for this. So we need to put effort into it. The patient will then help find the type of support they need. And it's important for the medical team to understand what matters to them. This can then be used to motivate the patient. Just yesterday, I saw a patient who was keen to see her 4-year-old boy grow up. This is important information for me, as important as blood levels, because knowing this, I can then work out with her how to achieve this. So my role then becomes more the role of a health coach. We need to be as flexible as we can to make it easy for the patient to do the right thing. Sometimes only minor changes are needed. For example, working out when to take medication to minimize side effects or work around work patterns. But sometimes it's more difficult, like getting blood tests checked out of hours or changing dates of clinic appointments. Here in Scotland, I've got a couple of farmers who couldn't possibly have any appointments in the lambing season. So this is important for me to work around that.
How does integrating psychosocial support and education into liver disease treatment impact patient adherence?
most people don't need formal support and education, but I think that every encounter with us should be as supportive and as educational as possible. Less often, some people need formal psychosocial support to improve their motivation or their understanding. I feel that this is often patients with additional needs, like medical conditions, substance abuse, alcohol issues, and all these factors are also risk factors for liver disease and need to be addressed. This is done preferably with peer support and resources that in the patient's language, and we should strive to get this for the patients in their language.